When an Indigenous youth arrives, their internal alarm rings continuously. Their nervous system is caught in an endless loop of fight, flight, or freeze. In this simplified map of the brain, complex trauma forces the fear center, the amygdala, into overdrive. Logic centers remain dark. As this alarm floods the central nervous system, it becomes physically impossible for a young person to process feelings of safety or human connection. Any psychological therapy or behavioral correction is ineffective right now. We have to deactivate the physiological alarm system first. Standard institutional care often misses this biological reality. Traditional management tries to discipline outward behavior, punishing a youth for acting out without recognizing the blazing internal alarm that triggered it. Treating a biological survival response as a simple discipline problem backfires. It pushes the youth further into isolation and reinforces the trauma they are already experiencing. At Nightwind Treatment Center, we approach the problem differently. Healing requires mastering the nervous system itself, rather than trying to manage the symptoms. Achieving that kind of complete biological reset means designing an environment centered entirely on physical and emotional safety. We call this the 24/7 crucible. The primary mechanism of change inside this crucible is the youth care worker. They step directly into the chaos to act as a reliable emotional anchor for dysregulated youth. The first tool is attachment, relentless connection. Our staff show up continuously, especially in the exact moments a youth tries to push them away. The second tool is attunement. We train our workers to read subtle, unspoken internal cues. Instead of reacting to surface-level aggression, they validate the deep, underlying pain. In practice, a worker holds a completely calm, grounded boundary while a youth escalates. This interaction has a direct biological effect. The worker's modeled emotional control acts as an external regulator, physically coaxing the youth's heightened nervous system to match their calm state. That unwavering, non-judgmental presence pulls a young person out of survival mode so they finally feel safe. Once baseline safety is established, we guide youth through a highly structured healing journey. We blend Western clinical science with traditional Indigenous wisdom. The clinical foundation relies on evidence-based practices like dialectical behavior therapy. We teach actionable emotional regulation skills. We weave these clinical data points into the 7 sacred teachings, mapping therapeutic nodes precisely onto the medicine wheel. This STAGES model begins with physical stability, pushing upward into trauma awareness, growth, empowerment, and locking at the peak of success. By integrating clinical rigor with deep cultural roots, we provide a clear path from severe complex trauma to a reclaimed, confident personal identity. The reality of this clinical environment is harsh. It is incredibly intense emotional crucible that demands fierce accountability and profound empathy from every single member of our staff. Neurological healing is never a straight line. There are inevitable setbacks, and workers must maintain incredible resilience and patience to keep the fire going. The payoff for that resilience comes in quiet, profound victories. A youth's nervous system finally settles. They laugh genuinely with a staff member in the kitchen. They begin looking forward to tomorrow. By committing to this rigorous process, professionals actively sustain a young person's self-worth and nourish their capacity for healthy relationships. We invite dedicated professionals to step into the 24/7 crucible. Embrace the hardest, most important work of your life